Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the Trendelenburg assessment or test. So what is a Trendelenburg test? The Trendelenburg test is used to assess the strength of the hip abductor muscles and the integrity of the superior gluteal nerve. By evaluating the position of the pelvis during a unilateral stance, this test can identify weaknesses of the hip abductor muscles. Healthcare professionals can detect any nerve dysfunctions, establish a baseline, monitor progress, and incorporate effective treatment plans. A positive Trendelenburg sign is indicated by a dropping of the pelvis on the lifted leg side below the level of the opposite side, while a negative sign is indicated by a rising of the pelvis on the lifted leg side above the level of the opposite side. There are a variety of healthcare professionals who can use this test, however, it is commonly used by physical and occupational therapists. Here's how to use the Trendelenburg test. The first step is to enter the patient's name plus the date and read the objective and instructions to make sure you're incorporating the test appropriately. The second step is to then conduct the test. The final step is to read interpretations as included and add any notes to being integrated within treatment. To view a sample assessment of the Trendelenburg test, feel free to visit carepatron.com where you can access and download it for free. You can also access the test via our platform. Filter by community and assessment, then type in the keywords to find the note. You can edit however you wish and click publish to complete. Thanks for watching, and remember to subscribe to Carepatron to view more healthcare videos in the future.